once. All right. So good evening, everybody. Thank you so much for joining. I know everybody has a very busy schedule, and welcome to our first Doctors for Humanity call. It's a pleasure to have you all with us today. My name is Shaz Mansour, and I'm serving as the Doctors for Humanity Program Manager, and I'm going to be your MC host for this meeting. And I'm excited to share more about our healthcare volunteer group and all of the incredible work that we do. As we get started, I'd like to introduce our mission really quickly, which is just to empower healthcare professionals to make a positive impact on global health by providing essential medical care and support to underserved communities. Through collaboration, volunteerism, and advocacy, we're working hard towards a world where access to quality healthcare is a reality for all. So Doctors for Humanity is an initiative that Dr. Lamani has worked really hard on and he came up with. So in a moment, we're going to pass this off to him so he can tell us about his vision for the program and the initiative. But really quickly, just a quick reminder for everybody, we have a really hefty agenda that you can see here, and I want to be cognizant of everybody's time. I know everybody's very busy. So in order to stay within the hour-long time frame and also have ample time for questions at the end, if all the speakers can please stay within 5 minutes, that would be absolutely perfect. So Dr. Lamani, take it away. I think you're muted.
He's on mute.
Sorry. Thank you so much, everyone, for joining us. And thank you for the team that has been assembled today, who's going to give some overview of what Humanity First do. Doctors for Humanity is a community group. It's not a separate entity. We work under Humanity First USA, and the Humanity First USA have been registered in USA since 2004. And since then, we have been working, our physicians have been working in multiple capacities, including disaster response, philanthropic activities, hospitals. This slide actually gives you some idea. It's not inclusive. We don't have enough time to go through everything, but in 2004, we got registered. In 2005, we started working very quickly because we had disaster in Pakistan and in Kashmir, where in Balakot in Kashmir, where more than 80,000 people died. So we responded there. We were there for 7 to 8 months, and we did a lot of work there. Then we responded to Haiti disaster, Turkey disaster, and multiple hurricanes over the years, Sandy, Maria. Then we started during non-disaster time, we started some programs our doctors did. In 2010, we started Gift of Health program, a Gift of Sight program. And long before that, we had surgical trips, which were going to Africa. Around the same time, in 2010, we started Humanity First student organizations because we realized they wanted to go on Gift of Health trips. So we have now multiple, I think more than 45 Humanity First student organizations in different different universities. And then we started working on building hospitals in the needy areas. We built, Humanity First built Nasir Hospital. We'll listen to Majid Khan Saib later about that project. It is in Guatemala, state-of-the-art hospital, provides a lot of services. We are also now building Eye Institute in Burkina Faso. This comes under Humanity First as well. So anyway, despite these efforts over the years, we were not able to get all the doctors together. So that's where Doctors for Humanity concept came. We wanted all the doctors to come under one banner. We communicate, we talk, we work together, we get ideas from each other, and do under one unified work as a community in Humanity First. So that's the whole concept. So we hope that through this orientation, you will learn more about various ways you can serve and contribute the Doctors for Humanity family. Next slide, please. So here is the 5 aims and objectives of today's talk. So this is our vision. So we want to train all our doctors in disaster response. We already have a very good disaster response training. You'll hear about that. We have a couple of years of gap because of COVID, but we are going to restart that this year. Now, we always do deployment of doctors in disasters. We want to organize this capacity. Dr. Kaleem Malik is our medical disaster response director, and also he's the director of our training program as well. So he'll be talking today as well. Then we do medical missions, gift of sight, gift of health, surgical camps, and dentistry camps. There are lots of them in Loop. You will hear about them, and you should. We will talk about that on our WhatsApp group, so you can join any one of those. Then we want to fundraise as well, because without fundraising, we won't be able to do all what we do. One of the fundraising program that we have is Nasir Hospital Care Fund, which people will talk about that a little bit later. Majid Khan Sahib and Parvez Khan helps us in that a lot. So this way we can see patients free of cost, or we take care of their cost when they come in our Nasir Hospital. We also do individual services. We are working on free clinic visits. We have a concept. We are going to do a web-based program where people who are in need will sign up to see doctors free of cost, and then we'll have all the doctors like you all whoever want to help out will register and put their schedule, maybe 2 days, two visits a week. Maybe you give it to us, and then we will schedule those patients for 2 visits on that week, and then you can see them free of cost. And this way we'll do free clinic service. That's what we're going to initiate soon. We are also would like you to volunteer in our HF Healthcare, which is our hospitals, which which Majid Khan Sahib will talk about. And we do a lot of local vaccine programs, like we have done free flu vaccine in the flu vaccine time. So we will continue to do that, so that we also help local people here. And also, most importantly, we want to have a goal of building our community, doctors community. So we like to, we're open to suggestions, but we want to start with doing like an annual retreat where we want everybody to come, where we talk about what we did during the year, what we want to do, and then enjoy each other, know each other, do some CMEs. And then also we also like to do this type of calls on a regular basis. This way we can organize, and some disaster happens, then we have easy access to everybody. And our medical missions, once we arrange it, then we can put it in front of you guys and you can sign up for those. So that's all I have to say. I really appreciate you coming in and listening to us, and hopefully you'll be our long-term volunteers and donors. Thank you. Back to Shaiza.
Thank you so much. Yeah, it's very exciting hearing everything that's going to be going on, and just kind of diving right into the first initiative that Dr. Mulai just talked about. Is Dr. Kaleem Malik here to talk about disaster response training courses?
Hi, everyone. Can you hear me okay?
Yes, we can.
All right. I guess you'll flip the screens as we go across. Hi, assalamu alaikum, and good evening, everyone. It's Dr. Kaleem Malik. I'm a trauma emergency medicine physician by training and specialty in hospital healthcare leadership for the last 25 years here in the Chicagoland area, just running trauma centers and emergency departments. Had the great fortune of joining Humanity First efforts right at its inception about 25 years ago, and watching it evolve. I'll try to be very quick, very brief. It's a huge subject to talk about. Usually it's an hour-long presentation or so, or a little longer, that I've been giving in global health forums at different medical schools and venues. But in the next few minutes, I just want to share with you what we do for disaster response. We have a disaster response training course that we prepare individuals before they're deployed. But before getting into that, giving you an idea why a training course was so necessary, we are working under the guidelines that were initiated by the United Nations World Health Organization, WHO, and also PAHO, Pan American Health Organization, that they launched the EMT, Emergency Medical Team Initiative. And under that initiative, medical teams are certified and they're deployed to work in conjunction with the Ministry of Health of affected nations that have a disaster. And I'll talk a little bit about my most recent trip to Turkey and how that went, if there's time on that as well. So what we try to do is have a very synchronized, coordinated, well-orchestrated response that is very needs-based for the nation or country or region that we're going to assist, because our goal is really to build capacity of that country that can no longer serve the needs of its own folks who are affected. And in this in this disaster course that we put together, it mimics, if you're physicians listening or in pre-health professions, you'll know that we have ACLS courses, BLS courses, advanced trauma life support courses. So it mimics a 3-day boot camp, our 3-day training. And we've been doing it every year for many years now. But as Dr. Lukhmani mentioned, during COVID, we were unable to do these courses. Very exciting courses, very robust. They touch on a lot of different subjects, a lot of human subjects that really, we don't want to throw people into a disaster setting without knowing the hierarchy of reporting of what each person's role is. And please don't be mistaken that you have to be a doctor or a nurse or someone in the specialty of medicine to be involved in disaster training. And in fact, we welcome everyone. Having the medical background is great. We'll utilize everyone's ability, but some of the best physicians that we've vetted out during the 3-day course have actually dropped out. So it's a fairly robust and aggressive training course that we go through. We drill real life situations. We mimic real disaster situations. And just to give you an idea what the 3 days entail of what our emergency medical team is expected to do, we're supposed to see about 100 patients a day, a very self-sufficient team that is able to mobilize and move from site to site, to be light, portable, adaptable, and go from area to area and get to the areas that need the most care. So the things that we're responsible for are the initial assessments of folks that we see, their triage, resuscitation, right down to wound care, fracture management, providing anesthesia or pain measurements, local anesthesia, sometimes minor surgical procedures. Many of us who are qualified to do will do minor surgical procedures, from suturing, wound repair. And then, of course, you've got to address the very medical needs that the folks have that are a result of non-disaster related medical attention that they may need. You've got injuries and broken bones and things that you're taking care of that are resulting directly from a disaster. But then you have folks who can no longer get to a doctor during a disaster, but they still need medical attention for their high blood pressure, their diabetes, their chronic illnesses, their asthma, whatever it may be. Well, they still need care. And all along in the backdrop, you have to keep in mind, women are still giving birth, the pediatric population, children, they all have to be seen. So life goes on. And you have to be able to address all of these situations, not just the acute situations that are coming up from the disaster. And a lot of that was really, our skill sets were tested very well in Turkey just a few weeks back in February and March when we deployed there, because we addressed some of the injuries from the earthquake of the folks that were pulled out of the rubble and some of their immediate injuries. But then we also had to spend most of our time addressing the chronic illnesses and the acute exacerbations of chronic illnesses. Very thrilling, very exciting. But those are some of the things that we see on a day-to-day basis when we're there. So you have to be able to provide care in the constitution of a team that will include doctors, nurses, and strategic logistics individuals, and folks that can put this team together. So again, this is something that we do to really work with the host nation. The most recent example, of course, is Turkey, and we were working directly with the boots on the ground from the Turkish Red Crescent and the government officials that we made relationships with, and they had allowed us to participate. Very uniquely in Turkey, if you're wondering, we were one of the few medical teams that were allowed internationally because of the relationships that Humanity First had already established there. And that enabled us to penetrate into regions where other teams could not get to, and collaborate with folks to provide. I think, Dr. Lukhmani may have mentioned, we probably did about 150 to 200 patients a day. It was an amazing experience. Our efforts, and he'll touch more on it later, they were ongoing until, I think, from the middle of February all the way to Dr. Lukhmani, maybe like about a week ago or 2 weeks ago, Dr. Ifti came back. So it was a pretty sustained effort, and I don't think any other team stayed that long to provide that much care. So that's the deep penetration that Humanity First has the bandwidth to put together. And this particular group, the Doctors for Humanity group, is really trying to accomplish exactly that. Create a roster, create a bench with the depth and talent and the expertise to be deployed, because not everyone can just go on the drop of a dime at the last minute. You have to obviously take care of things back at home, give notices to your supervisors, your bosses, your hospitals, wherever you may be employed, and make travel arrangements, and then just go. Very fortunate that I've had the opportunity that whenever there was a disaster to really deploy within 24 to 72 hours and just leave and get there. And that is a task in itself. So I'd like everyone to be excited about the courses that we offer. We're getting restarted. We're looking to do it this fall in September, most likely in the Chicagoland area. We'll rent out a facility as we've done in the past, and we'll do 3 days of simulations of trauma situations, learn about the hierarchy, how the team works together as a team. There's no single individual that's more important than anyone else. The 12 to 15 man team is exactly that. And we really take great pride in working shoulder to shoulder with one another in the spirit of that service. And it's not, it's not, it's terribly exciting, but it's not for the faint of heart. It gets quite strenuous. There's a certain amount of endurance that one needs, and we have to be really upfront with that. It's a great opportunity to serve, but this is not just a Boy Scouts camp trip that you're going to go in the woods. You'll be sacrificing of yourself to do so, but the rewards are something I cannot even describe in words. That the amount of lives that you may touch. If there are other slides you can show here, that you can see some of those things that we did in Turkey recently. But yeah, some of these things you can see in the lower left-hand corner, you'll see that there's, and I'll finish off with this really quickly. The people were moved to these tent cities. You got to keep in mind, the news media did not report much here. You had 50,000 people that died in that rubble, and they were being pulled out days and days after the earthquake. They were still being pulled out. Not only did 50,000 plus die, 2 million were displaced in a radius of 250 miles. So that will be equivalent to something like Chicago to St. Louis, or a stretch like that if you're familiar with the Midwest corridor. And city after city was just decimated. And that's what it looked like. It was just, everything was an epicenter. They're moved into these tent cities. And in these tent cities, there's no running water, there's no electricity, there's no Wi-Fi. So you're pretty much on your own, and you have to coordinate very well with all of the other agencies that are there to help each other along, and you work together as a team. I think there were just tens of thousands of children that were orphaned in this period. There's a picture with the little boy that's hugging me there. He was walking around with a broken hand, broken finger that I had to reset, realign, and splint. He was walking around like that for, I think, a good 8 days in tremendous pain. A gentleman up on the right side has got this second, third degree burns across his arm that we had to do some wound care and debriding. There's a baby on the table in your right side of the screen where this woman saw us taking a little tea break, coffee break. It was probably around midnight or 1 a.m. We were just trying to get a little bit of rest, and she came storming in with her baby, who was not breathing well, was not looking well, and we were able to tend to that child immediately. So you can, these particular pictures will give you an idea that it's men, women, children, babies, elderly, young, all ages, and it's an absolute privilege and honor to be able to serve them. Last picture in the upper left-hand corner is just to give you an idea how life can change in the blink of an eye. There were people just sitting, you can take a screenshot and zoom in. Those are rooms. That's a living room, a kitchen, a dining room, and they were just smashed, trashed, nothing left, and folks died. And these are the kind of things that we were seeing, how in the blink of an eye, life changed completely. You can see a person who has chronic illnesses, they deteriorate over time. And that's the key. In disasters, that's not the luxury. It's the blink of an eye, and life has changed from having everything going so well, beautiful, blue, sunny skies, to devastation. And that's what it is. So if that's something that inspires you, that you can make a difference, then we want you on our We need everyone that is excited to do something like this. It's transformative. I know it changed my life over the years, and I can share with you 1,000 stories, but I'll stop short here. Sorry for speaking fast, but Dr. Loghbani, I know it was on a time crunch, and I wanted to get this in. If there's any questions at all, again, thank you for the opportunity to present this to
Yeah,
you.
thank you so much, Kaleem. I just want to add that Kaleem got award from Red Cross. I think, what was the exact award, Kaleem? Can you share?
Yeah,
And we'll be done.
for that. I was very humbled to be the 2020 recipient of the American Red Cross Humanitarian Year. They had just seen basically a Lifetime Achievement Award that just saw multiple disaster responses, local response locally in Chicagoland area and trauma centers. And
Yeah, thanks a lot for that. And I think for all your hard work, and you've been recognized on multiple news medias. And if you can search Kaleem Malik, you'll find all his good work on there. Thank you so much. Okay, Shaiza, back to you.
Yep, thank you so much, Dr. Malik. Every time you speak, the passion just really shines through, and I feel so inspired every single time. Here are some more of his pictures. Just this is the disaster relief training that's showing up in the survey. So quick segue, I just put a survey into the chat. If you guys would please fill it out, it will take about 2 minutes, very quick, yes or no questions. So now we're going to move on to Musa Loghbani, who's going to talk to us about Gift of Health. Musa?
Hey everyone, thank you, Shaiza. My name is Musa Loghbani. I'm a medical student at the University of Toledo. I'm serving in the student division as well, where we have student organizations, but specifically Gift of Health is a program that a lot of students participate in, but that's not without the help of our healthcare professionals that really lead these teams. So if we could go to the next slide, we can see a little bit more about what these Gift of Health medical missions are. So they've been happening since around 2010, around 10 to 20 people with doctors, dentists, nurses, other allied health professionals will go on a team with these students that fundraise $1,500 each, as well as the team members to join on this medical mission. And the teams go to, typically Guatemala, but now we're expanding to other countries as well. And it includes of 3 to 5 days in the clinic where we're seeing patients, providing them free medical care, free medications. We average around 200 to 800 patients each day. And this is not a time of disaster, just to put into perspective. It's just in peacetime where these people need help. And we usually plan to organize 4 or more Gift of Health missions every year. So it's a really good opportunity for students, medical students. We're going on a trip this summer with my medical school students, as well as some other undergrads, to Guatemala. There's another team going to Guyana, where we need doctors for that as well. And there's always opportunities coming up for these type of medical missions. So that's a very, very brief overview of everything that we do on these Gift of Health missions. And I hope you guys are inspired to continue to be involved.
Thank you so much, Musa. Yeah, I've been on a Gift of Health trip. The organization is great. I love it. So thank you so much for speaking about it. And next, we're going to go to Dr. Ehsan Khan, who's going to talk about Gift of Sight. Dr. Khan?
Hello, assalamu alaikum. Can you guys hear me? Okay.
Yep.
Yes.
Okay. Okay, great. Yeah, I'll make this very, very quick. First of all, it's an honor to be a part of this group, and it's always exciting to hear stories and get inspired. I think the work that was done in Turkey was incredible. Those pictures were amazing, and I know there are many volunteers along with Dr. Kaleem Malik who've done extraordinary work. May God bless you. And it's a reminder that we should all continue to pray for all those that are suffering in Turkey. It's just amazing how the world came together for that. With regard to Gift of Sight, it's a small, humble effort on our part. Basically, we started in 2010 with trips to Guatemala, where we set up shop and we did eye surgeries and provided eye care to those in need. And we've gone on 9 or 10 trips since 2010. We did take a pause during the pandemic. We do have additional trips, hopefully in the pipeline for the coming this year and in coming years. So one of the main aspects of Gift of Sight is actual surgical trips where we go and we provide eye care. Number two, in West Africa, there is a hospital, an eye hospital called Masroor Eye Institute, which was created by philanthropists in the United Kingdom. And Humanity First is now collaborating with that eye hospital to provide support. And I and a few others have gone there to visit. We did a few surgeries there back in November, and it's a very exciting project. So Humanity First will continue to support that. You just heard some great initiatives from Musa Lugmani with Gift of Health, and him as well as a student in Temple, Ramin. They've taken on a project where they've been providing eyeglasses to those in need. So several campuses and schools are collecting eyeglasses and then providing those. And so Gift of Sight is giving them support as well. At Nasser Hospital in Guatemala, of late, there's some exciting work that's being done in their eye clinic under the leadership of Majid Khan, who you're going to hear more about Nasser Hospital, and Dr. Asma Bajwa, who's an ophthalmologist in Virginia, who's doing a lot of work, and she's actually collaborated with Gift of Sight in the past. And then finally, in collaboration with Dr. Lugmani and these international trips, we also plan to support eye care in the Marshall Islands. So basically the asks from all of you is to spread the word about Gift of Sight. If you know of eye care providers, ophthalmologists, and optometrists who would be willing to go on trips or support our programs, we're always willing to expand our team. And then obviously we're looking for as much financial support as we can get, because we do have some other programs that are in the pipeline as well. So that's pretty much all I have. And I look forward to working with many of you in the future.
Thank you so much. Love hearing about Gift of Health, Gift of Sight, all the initiatives where I feel like it's very hands-on and you can make a difference, from even right here with eyeglasses drives and things like that. So next we're going to go back to Musa Lugmani, who's going to be telling us about the Doctors for Humanity retreat. Very exciting.
Thank you, Shiza. And I don't think anybody mentioned, but Shiza, you're involved in a Humanity First student organization, and I think you guys are starting to work on that Gift of Sight eyeglass drive soon, as well as
Yes,
Gift of
we
Health
are.
stuff. So that's good to hear. So with regards to the retreat, the main objective here is to really get all of the doctors together to meet each other and put a face to all the names. I think it's important, a core mission of Doctors for Humanity is to really build that network and build that community within Humanity First. And the best way to really do that is to, meet each other in person, enjoy time with each other, network, learn about different opportunities, and just take your time away from your busy schedules to kind of reconnect with this side of the world, which is focused on philanthropy and all of the other services that you can spend your time in. So this is all tentative that we have right now. It's not set in stone, but this is what we're planning at the moment. Who is invited to the retreat in 2023? All Doctors for Humanity members and their families are welcome to join. We're planning for sometime in the end of October. We've chose this weekend, but it's not set in stone, October 27th to 29th. Our potential venue is the Smoky Mountains in Tennessee, so it's a nice scenic area. We'll let you know more about the cost and the registration. That form will be shared via WhatsApp and email, so we'll make sure you get it. But this is just another great opportunity for you to really join this community and build that sense of belonging in Humanity First.
Thank you so much. I'm very excited about having a retreat, because that's definitely something new that we haven't done before. Moving on, we're going to go to Majid Khan, who's going to be telling us about the Humanity First Healthcare Services. And he's actually the CEO of Humanity First Healthcare, so he's a perfect person to speak about it.
Hello, everyone. This is Majid. We'll talk about HF Healthcare, which is a subsidiary of Humanity First. In 2017, when Humanity First decided to build a hospital in Guatemala, they soon realized that they need an independent organization to help them build and manage hospitals. So a baby was born and HF Healthcare was incorporated in the USA. Next slide, please. The business model is, it is a little different from Humanity First. Basically, we try to create healthcare help in creating the healthcare infrastructure in the underprivileged communities. We focus on long-term sustainable health, and we try to replace the traditional donation model with other revenue streams. Can you go on to the next slide, please? We have less time, so I'm just trying to rush things over. Our first hospital, which is owned and managed by HF Healthcare Services, this is the performance for the first 4 years. We have done more than 1,000 surgeries, including kidney transplant surgeries as well. We have attended more than 48,000 patients, and more importantly, 9,000 of them were financially helped. During this time, we were able to generate revenue. No, can you go back, please? Go back. Yes. And this helps in sustaining the hospital. We are also, I'm very humbled to say that, we are one of the top online rating we got in Guatemala for our customer service and the patient care. Can you move on to the next, please? Next slide. Yes. So these are the general surgery, specialties we are working on. We have the first 4 and the first 6 specialties. We have the specialist on payroll. The rest of them we get from visiting faculty locally. And of course, this is where we are also looking for partnership with Doctors for Humanity. Next slide, please. When Humanity First decided to build this hospital, they had no idea that the impact will be so far in the region. You can see the blue map on the right. We get patients from every province of the country, and it is actually the impact is spilling over around the other countries as well. Next slide, please. Given the successful business model of HF Healthcare, we helped, as Dr. Essen talked about earlier, we helped our sister organization in UK getting this beautiful facility, and it was inaugurated on 19th of November 2022. We are also building a hospital in Ivory Coast. This is a little bigger facility than Nasser Hospital in Guatemala, and we hope that we'll be able to open the door for the patients in middle of 2024, and that's also one of the opportunities you will get to serve in. Next, please. After the success of first 4 years success of Nasser Hospital, we launched Sustainable Healthcare Initiative. Next slide, please. I'll just quickly go over this. Next slide. Yes. So first is, of course, that we want to include a state-of-the-art diagnostic center, which will include CT scan and MRIs, etc. This is not there at the hospital, which is very basic at this moment. So over the next 5 years, we want to do that. Also, we would like to add mobile health clinics. That the clustering of physicians in the urban areas, they actually create a vacuum in healthcare delivery in the rural areas. So that is where we would like to work on. Next slide, please. Increase in inpatient capacity, we are working on, and we have already started working on this. Data and research center, investing in data and research is so important. It will help us not only formulating our next 5-year plan, but also we can help the other organization in giving them the required data. The last one is the global healthcare access. This, we would like to do something for our fellow Americans. Although we go out in the underprivileged areas, but there's a large segment of population which is underinsured or uninsured in USA. So the plan is to take them to one of our facilities and give them quality, affordable healthcare. So that is what we are also working on, and we'll be launching it later this year. And this is also one of those places we are looking for partnerships with people like you who can refer the patients and who can become our partners in this cause. Next slide, please. How can the other organizations help us? Of course, we are looking for value-added partnerships. If the place you're working, they offer some global, like some universities offer global ophthalmology or things like that, we would like to work with you. Then donate funding for underprivileged. This is, of course, as I said before, we have helped more than 9,000 patients in the last 4 years. Provision of staff training opportunities. If your organization can help our staff members or doctors coming here for some exposure, then the equipment donation, that is what we are looking for also, because that's one thing which we lack in some areas. Next slide, please. And that's the vision of HF Healthcare in 2027. We are hoping that we'll be able to achieve this sustainable healthcare initiative in Central America and also complete the hospital in Ivory Coast. The next in line is Liberia, Tanzania, and Indonesia. So this is all the opportunities are awaiting for you guys to come over and and join us in the effort. That's about it from my side. If you have any questions, I would be very happy to answer during the Q&A session. Thank you so much.
Thank you so much for that. I'm currently a pre-med student. I don't know if I said that. So just every time I hear about HF Healthcare, it's always so inspiring, and just all the ideas that you and your team and everybody has always just seems like such a wonderful idea. So next we're going to move on to Pervez Khan and Alana, who are going to be talking about the Nasser Hospital Care Fund.
Hello, everybody. This is Pervez Khan, and I am part of Humanity First since its inception, been part of many projects. Disasters happened in the last 20 years. I've been part of that. Then I took a leave for 3 years, so I am back, and I'm very excited to be part of this team, especially the efforts we're doing at the Nasser Hospital in Guatemala. I was part of the team who developed the fundraising efforts throughout the US, and I was able to visit the hospital as well a year ago. Very excited. So the incentive we are talking about today is the Care Fund. It comes into picture when there is a cost involved for a patient. So there is a minimum cost, or you can say is a bare minimum cost to cover the patient procedure or his treatment. So as mentioned by Majid Khan Sahib, since the start of this hospital, there are around 9,000 patients were helped who were underprivileged, who were unable to cover their basic cost. So that's where the hospital is already playing a huge role, and we need help from this group of people who are doctors and who have a strong words to spread the word that where the money is needed to help the needy people. So the current priority is to generate the funds for this group of people who are underprivileged, seeking the medical care at our hospital. And your continuous donations will help the doors for these kind of people and increase our capacity to provide more help to the needy people. HF does not want any patient to turn away because of his financial situation. That's where we need help, and basically we need donations from the team members, and help us by spreading the word as well. So that's all I have. I'm new in the team, but maybe Alana can help me out with some stories or other things to share in this incentive.
Thank you so much. I'm Elena Ladone, and I lead fund development at Humanity First USA. So you see on the screen just a few of the many examples of patients who have benefited from financial assistance as they've received care at Nasser Hospital. So this is the Care Fund is a strong initiative of the Doctors for Humanity community, and then certainly there are many ways to contribute to building up this community, to serving patients directly, and to leaving your and your family's legacy with Humanity First. So I am always available to talk more about how we might do that. Thank you very much.
Thank you.
Thank you so much to you both. I actually visited Nasser Hospital last summer, and it's an absolutely state-of-the-art facility. The staff, the people in Guatemala, everybody is just so wonderful. And so the Nasser Hospital Care Fund is truly, truly amazing. And everything they've done with the hospital is just great. And now we're going to, what just happened? So sorry. I think it might have been a link. 1 second. Okay, here it is. Can everybody see my screen?
Yes.
Okay, so now we're going to move on to the Q&A session. If anybody has a question, please either speak up or type in the chat, whatever is easiest for you. But this is a great time to ask any questions.
Assalamu alaikum. Hi, everyone. My name is Irtaza Khalid. I'm currently an internal med resident at the University of Nevada. And I have a question for Dr. Luqmani and Dr. Malik, if they're both available on the call. For disaster relief efforts, do you guys have any programs for residents or fellows? I'm interested in critical care myself, so I'll be kind of tied up in fellowships for the next 3 or 4 years. And I was wondering, what options do residents or fellows have to be able to serve? Thank you.
This is Dr. Luqmani. Yeah, so actually we have several residents over the years have gone with the teams during disaster response. As well, I remember from Baltimore when we had Puerto Rico disaster response, we have actually called for the medical staff there. We just sent them an email saying anybody wants to go, we need help. Lots of residents also signed up. They were the faculty, and then they worked with them in disaster areas. So as Kaleem Malik said, even if you're not a doctor, we still open, they go there, because in any team, there are 2 to 4 doctors whenever we send, and the rest are usually support staff in triage, in pharmacy, in other areas. They will help in security. So we need all of those staffs, and we train you guys. So the best thing I would answer to that would be to attend the disaster response course, and you'll get the whole gist of it. And anybody who's trained, it gets a priority when disaster happens, and you can go there, and that will help you with your resume as well.
Awesome. Appreciate that. Thank you so much.
You're welcome. I just have a quick question also for Majid Khan Sahib and for the fundraising team. I think we have over the years, Doctors for Humanity and doctors have tried to raise funds, and over the years, our goal is to keep a pool of maybe $100,000 to make sure that when when those patients come in, then they are helped. Is there any way to track that and how that process would work? If we, for example, raise funds, where does it stay, and how do you decide about which patients need to take care of, and do we get a feedback?
Yes, I can answer that, Dr. Luqmani.
Please.
We have we keep like a foundation account in Guatemala. So any funds received under needy patients or underprivileged, they are deposited in that account. And as and when a patient turns up, and I can assure you they turn up every day. And so when they come, they are taken to our social services department, who have a very a thorough process of finding out whether the patient deserves how much financial aid is to be given. And that process is recorded and is documented. And sometimes when it is more when a surgery is needed or some more expenses are needed, then our social service department actually even visits their home just to find out that the money is not going to somewhere where it is not needed. So it is a very thorough process, and we take care of that. And to the other part of your question, we are, if need be, we can actually have the stats of the patient provided to the donor if it is required. So it is that can be done as well.
Yeah, thank you. Sometimes I was wondering if somebody, a very sick patient who needs a lot of care, big surgery, I mean, one can do a drive for that too. So we can, since we are getting organized, maybe we can come up with a system where we can, bring it up in our meetings. And then, people normally love to sponsor. I would love to sponsor, somebody who know the story, what's happening, and then you sponsor, and then the person gets better, and then you get a feedback. So that's why I was wondering, I mean, we can.
Yes, of course. Yes, yes. That will be done and that can be done. And we have a plan we have actually getting all the patients who need surgeries and we can't afford to provide them. So we can provide them the list to Doctors for Humanity management, and they can sort of then get sponsors for us for particular patients. So then, of course, yes, that we are already in the process of doing.
Sure, thank you.
Yes, whoever has their hand raised. Go ahead.
Hey, that's me. I'm I'm Asma Bajwa. I have a question for Majid Saab, please. Assalamu alaikum. Someone asked me this question, whether equipment and other surgical instruments or other medical or surgical equipment can be donated to the hospital as well.
Yes, it can be donated, but sometimes if the equipment is used, then when it arrives in the hospital, it may or may not have the required after-sales service, and it sort of gets dumped on us. So yes, we are certainly looking forward for the equipment if it can be arranged locally through a vendor, or they can provide us, we can provide them with the quotations, and they can provide us with the funding, and then they can either pay directly to the vendor or they can pay us, whatever is suitable. But we would certainly like to have the equipment which comes with some after-sales service and maintenance. Otherwise, it's not that viable for the hospital.
Thank you. So the after-sales service in Guatemala is expensive to, hard to get for that type of equipment?
Not necessarily. We have almost, if it's not there in Guatemala, it is there in Mexico, and they support from Mexico, or they support from Panama. So
I see.
It's a regional office. Regional offices are almost present everywhere.
And do you face any challenges in the customs department when the equipment is being sent from the United States, for example?
All the time. That is one of the reasons we don't want the used equipment to be sent to us from elsewhere, because there are some conditions, and then sometimes it gets stuck in the customs department as well.
Thank you.
Thank you so much. And then we have another question in the chat from Usman Shah, who said, do you have a plan to train volunteers in Pakistan in the future? And I guess this can go to anybody here.
What's the question again?
Do you have a plan to train volunteers in Pakistan in the future? Or I guess like volunteer in Pakistan in the future?
Means that if somebody is in Pakistan, you train it, virtually? I didn't get the question. I mean, we do have Humanity First in Pakistan. That's pretty strong organization. They do a lot of work, and I'm pretty sure they do trainings and stuff there as well. So if somebody's in Pakistan, they can get connected with Humanity First Pakistan. We directly do not do any work in Pakistan because Humanity First USA, also there are like D8 group of Humanity First donor group. Each of the Humanity First is given different parts of the world. Pakistan comes under UK Humanity First. So if there's any training or any issues which happens there, disaster happens, then they respond. So that's my answer to that is.
Thank you. And then Usman Shah, if you want a clarification, please just type in the chat again. But we have another question here where Parvina said that, hi, everyone. I've been lucky to serve as a Humanity First volunteer as a medical resident in Puerto Rico. Is there a group of people with Humanity First that are interested in research, including case reports? And then she said we can work on research ideas together. So is there anything research involved, like that Humanity First is involved in research? Anybody can answer this one again.
We do have a research and development department at HF Healthcare, but that is mainly focused on getting some few ideas together for prefabricated healthcare facilities in the underprivileged and rural areas. But so we are limited to that part only.
Yeah, I know Pravina, she was a resident as well who went with the disaster response course. Now she practices. So thank you, Pravina, for that question. So I think you can talk to Majid Khan Sahib after this is done. That might be a good opportunity if you like to be involved in research. That will also help the hospital as well because they have that projects going on.
And then Fatima Malik said, is there a strong need for RNs or mainly just MD doctors?
Dr. Malik is on. It is for every, yeah, of course.
Yeah, I think so. It's they're a vital component of the team. So nurses are really encouraged. We look for nurses, paramedics, anyone with the EMT trainings. That type of medical background is amazing to have on a team because they can start IVs and administer meds. They can triage their wound care. I mean, you name it. So we there's only so much we can teach in a 3-day boot camp, and that's really to brush up on skills and to let you know what to expect. So nurses are a vital component to our teams. Thanks for asking that.
Thank you. And no, I agree. I also work in a hospital, and just seeing what the difference between doctors and nurses and their RNs are definitely an invaluable part of the medical team as well. Is there Asma, is your hand just still raised, or do you have another question? Sorry, I can't tell. Oh, it went down.
I have a quick question. Sorry
Yes,
about that.
please go ahead.
Hey, this is Irtaz again. Sorry about that. So regarding, again, the disaster relief efforts, going back to a little bit on the fellowship scheduling with programs and whatnot, is there an average time scale that you guys on the disaster team require, like a couple of weeks, a month, a week, that volunteers can spend time in? Because as you guys are probably aware, we have very limited vacation schedule from programs. So I'm just trying to understand how much time I can volunteer in a year, God forbid if a disaster occurs. Thank you.
Dr. Malik. Dr. Malik, are you on? Yeah, actually, our teams typically for the PAHO United Nations would like to have, if we send an official EMT1 team, they like 2 weeks. But if we send team just under Humanity First and the United Nations is not involved, then we usually do 1 week because most doctors can easily take a week off and we rotate. It's not that we come back, we just every week there's a new team going. It just adds to the cost because of the plane tickets, this and that.
Right.
But it's easy to schedule, easy to get doctors that way. But if you are going, sometimes we get invited by United Nations because we are registered with them. In that case, they prefer, they have a very strict guidelines, 2 weeks and certain types of doctors, and a lot of equipment we have to take with us because we have to be independent. They put us in the middle of nowhere and we have to do everything. So
right.
That's a big deal. For that is 2 weeks. So no more than 2 weeks needed, 1 to 2 weeks.
Sure, appreciate it. Thank you so much. Yeah, typically, I think we get 3 weeks in a year. And then in my experience as a resident, you can have 2 weeks together at a time if you ask the program directors, but you cannot have 3 weeks. So yeah, down the road, if anything like that occurs.
Yeah, I would say 80% time, Irtaza, we do 1 week in deployments. Yeah, most of the time it's 1 week because most of the time we do it ourselves. And because if we go under United Nations, typically we do only 2 weeks. That's first 2 weeks they're more interested in right after the disaster. So the first 2 weeks, and then we have to take a lot of stuff with that. It's very, very expensive to do. And then after first 2 weeks, typically, then small teams take over. we are usually done with those. And sometimes we do more too. I think last time when they asked us, we did, I think 3 teams went 3 times, 2 weeks each.
Okay. Jazakallah, thank you so much. Appreciate it.
Sure.
Thank you. Are there any other questions before we move on to the closing remarks? No, if not, I'm going to plug it later, but we also have a WhatsApp group. And if you guys join that, that's also a great place to ask any questions and also just keep in touch with everything that's going on. And also, just another plug before we close out, I do have the link in the chat for the brief 2-minute questionnaire. So please fill that out as well. So with that, thank you for all of the wonderful.
I have a question.
Oh, yes, please go ahead.
Sorry, I was unable to unmute.
No,
Is
totally good.
there any dates for a future mission to Turkey or Syria coming up in May or June?
No, actually, we at the medical trips, we closed that because locally the government told us that they don't need any more help. So our last medical team came back already. So we don't have any plans. Of course, we are doing long-term future programs. We have the Humanity First International is working on collaborating with them to do schools, rebuild schools. So we have raised funds and we have to utilize them only in Turkey. That's the law. You know, we cannot use any fund raised under Turkey name. We have to use it in Turkey. So they looked around and then we talked to local government, and looks like they want some schools which were destroyed. So they will assign those schools to us and we'll build those. So that's the plan. Munam Naeem Saib, he's going to be doing closing remarks. So he's a chairman of Humanity First here. So he would know maybe more about that, but I know that Canada Humanity First and US Humanity First, they're going to be doing those type of programs, long-term programs. We were thinking of doing something in medicine, but there wasn't any project that they assigned it to us, the local government there. Is that answer your question?
Yes, but actually I was also asking about Syria.
Yeah, in Syria, there is also, yes, Syria, there is a project going on. UK is doing that. We did go, last team went there, they met with them. The medical program did not pan out. We wanted to do something in medicine, but they even they got permission from Turkish side. But we were not able to get any medical mission approved where we could do a long-term help. We tried very hard for our surgeons. We have lots of surgeons who signed up. We wanted to see if they can do surgeries, but there wasn't any need for that, at least that later in the, in the game here. So we are, the future programs are now, which are coming up, are in Guatemala, Guyana, Africa, and in Marshall Islands for this year, other than the other programs we talked about earlier. So those are the opportunities for you to be involved in this year.
Dr. Lughmani, this is Hassan from LA again, gift of sight. With regard to Marshall Islands, can you tell us just very briefly about, like, if a doctor wants to go or a nurse, because that's quite a trip, other side of the world. Are there opportunities for like funding or financing the flight and housing, or how does that work for Marshall Islands?
Yeah. So that did go through. So we did work very hard because I went and did feasibility study, and then I figured out that the cost of reaching there is $2,400 just plane trip, plus the stay. So we met with the government there, and we told them that we have volunteers available, but the cost will be prohibitory for them to come. So they actually met the government, and then they approved 2 to 3 doctors can go in a team, and they will pay for their plane ticket. And we have actually asked for $3,000 per person cost. We are going to give them, they verbally agreed with us recently, and we are writing a proposal, and we'll just get the funding approved, but they did approve it. So any doctor who wants to go there, now right now it's going to be ophthalmology and dentistry, but whenever they need any other services, we'll send the teams. We're planning to do 2 teams a year, and that will be covered by local, by the government there. So that's a great thing that we were able to achieve. Lena is also working on trying to get some funding in terms of funding sources, because there is some funding earmarked by the government of America for that part of the world. And we heard that is underused. So we're going to look into that as well, so we can take bigger teams. So they said they can only afford 2 to 3 doctors. They can support for that. But if you want to get a bigger team, then we may apply for US funding, which is earmarked for Marshall Islands. And if it is a good program that we propose to them, hopefully we'll get it for that as well. But we do have funding.
Dr. Lugmani, I'm sorry to interrupt. May I have your permission to duck out? I have another conference call to jump on.
No problem. Yes. I think it's almost 1 hour, so I think it's time for closing comments as well. If there's no other
Thank
question.
you. My apologies. Thank you, everyone.
Thank you so much, Dr. Kaleem Malik, for all your help.
Thank you. Assalamu alaikum.
Thank you so much. I think we do have one more question left in this chat. So Doris Amin, you can ask your last question, then we'll move on to closing remarks.
Hi, Assalamu alaikum. Is there a need for IT professionals? Thank you.
So exactly, I think that when you in Humanity First, I mean, we have IT professional lead all the time. We have a whole department who takes care of IT side, and actually we absolutely need IT for our one of the projects that we like to do for Doctors for Humanity, where we try to develop a portal where we can sign up patients on one side and doctors on the others, and then the schedule in the middle. That's the concept. We are asking people around to see if we can get help. And Doris Amin, I know you're in IT, so if you really want to help us, that'll be a wonderful thing. Or if you know somebody who can make that happen. Ideally, there should be something on the market already we can modify to do that project. Of course, we have a whole IT team, and we always need more. And in disasters as well, we need them as well.
And in Guatemala, there is a data and research center where Majid Khan Saab, there is opportunity as well.
All right, thank you. Who should I reach out for in that case? Can I ask? Thank you.
Oh, for us, for Doctors for Humanity, just put it on Doctors for Humanity chat. We'll put, we can put you in that team as well, the admin team. And for Majid Khan Saib, you can send that even through Doctors for Humanity. You can put it up, and we'll connect you with him as well.
All right, thank you, Jazakallah.
Thank you so much for all of those wonderful questions. I love to see that everybody's interested and like really excited about this initiative like I am, and I'm sure everybody else on the team is also very excited. So with that, we're going to move on to closing remarks by Munam Naeem Saab, the Executive Director of HF USA.
All right, good evening. Assalamu alaikum to everyone. Thank you again, Dr. Naeem Lugmani, for coordinating this program. Doctors for Humanity are actually the medical staffs are very core and critical part of Humanity First. It's a core strength, and I think for both from disaster response perspective as well as all of the human development program that you heard. So appreciate everyone's help. One thing that I want to point out that I have the opportunity and honor to serve Humanity First from the day one. We started back in April of 2004, and we will be commemorating our 20th year next year, and we are launching a campaign called 20K for 20. Our hope is that we sign up 20,000 champions, 20,000 supporters for Humanity First within this year, starting with the telethon that is coming up 2 weeks from now on May 13th. And I really request everyone's help to bring that support to us, whether it is a small amount of $20. We just need supporters to sign up with Humanity First. I think once the program resonates with people, people end up joining, either going to the visit and or just giving the donation. The work we have done is significant. I was just looking at the international document that they released, that since our inception, we have helped almost 13 million people. And for a disaster response perspective, we have responded to 215 disasters, and those are in literally 162 countries. And doctors are the medical professionals, all of them are a critical part of that. Similarly, whether those are gift of sight program, I was looking at the huge number of 44,000 surgeries and the eye care that we have provided, and it moves on. Currently from the global health perspective. Yes, we do have big hospitals like Nasser Hospital, as well as the one Majid Saab mentioned, being in Ivory Coast and other places, but we are operating right now 10 of such medical clinics in the bigger hospitals, and from schools and education, everything you look at from the Human Development Program, Humanity First has significant impact, and it is due to the passionate volunteers. I remember very first disaster that we had in America, that was Hurricane Katrina. Back, I think it was maybe 2005 or 6 timeframe, I don't remember the exact year. But I was there, and there was a Red Cross lady, nurse, and she complimented, and we have this recorded in the interview. She said, I have never worked with such a passionate doctors group ever in my life. So that was a compliment, and I think that passion from that time on to up to right now is still there. So my hats off, my salute to everyone. All I ask for is to help in anywhere you can, whether you can go on a medical mission, whether you can go work in Nasser Hospital, Guatemala, or respond to a disaster, or help us with the needy patient fund, spreading the word, and more importantly, right now, help us in this campaign 20K for 20 to sign up as many supporters as possible. We have a huge task that we have taken under. The need is always growing. Those silent voices that do not reach to us. Yes, on the disaster time, you hear about it, and the news channels and social media is all talking about. But there are silent killers out there. There is a hunger. There is medical help that is needed across the globe. And with Humanity First. Significant impact. I think I'll just tell you a quick one story, and I know that we are running out of time. After the disaster of tsunami in Indonesia, I had opportunity to visit the Indonesian embassy. They had called out all of the charitable organizations to come and report. This was literally almost 6 or maybe 9 months after the disaster. And they went around the room. There were a bunch of charitable organizations sitting around. Some had raised 100 million, some had raised 20 million, so far. And when they came to Humanity First, we were small, we were just growing. I think money-wise, we had not even raised more than maybe $1 million or $1.5 million. But then when they went around the room, asking what work you have done. And when we talked about the amount of work that we had done, building up the Began boats there for people to restore their lives, the water wells, to medical camps, to so far, so on. And many of those charitable organizations were puzzled. And they asked me, what happened? How didn't you have the language barrier problem? Didn't you have this? How did you get in there? And we were so fortunate that because we had, through the community network, we had almost 100 volunteers there, and volunteers, medical staff, and others from throughout the world, whether that was Germany, USA, Canada, and other countries, had gone out there. We didn't have the language barrier at all. We had the local people, so we provided a great care. So our dollar is stretched significantly. So even if we have $1 million, it gets stretched because of all of the volunteer services that we provide. Anyways, I am passionate about it, and many of the people who are on this call, I know they are passionate, and I really appreciate everyone's help. So I will just close by saying that I sincerely appreciate everyone's effort, but I do need your help to promote our 20K for 20 campaign and sign up and then continue to work with Doctors for Humanity. Dr. Naeem Lughmani, that's all I have, unless otherwise there are any questions.
Thank you so much, Manam Naeem Saab. Your support and your vision has always been a forefront in all our efforts, and I think your motivation takes us way far. And I know what you said about stretching dollar. I think ever since I've joined this organization years and years ago, I've seen it, how for a small amount of money we can do really big projects, and I think that's the great thing about this organization, because almost everybody in this organization, I mean, we have only maybe a couple of employees, Everybody's a volunteer, so that's a wonderful thing. I do have a question for you. If you can let us know about this campaign, that the 20 for 20 campaign, and I can put it on our Doctors of Humanity group and email group so that they know about it, so that I can put it up, because there's several of us have not joined today's meeting, so that will go to everyone.
Okay, excellent. I think Elena can help to provide you, the flyer and all the details, of this 20,000 champions that we're looking for to sign up by our 20th anniversary next year. But it starts from this telethon. I'm hoping that we can at least sign up, somewhere close to 5,000, new champions with us to support us. The membership fee is very low, it's $20, but obviously whatever anyone can donate from that point onward. But core, the important thing is getting 20,000 champions to sign up with us in the same cause of this, volunteer help for humanity.
Yeah, we'll do that. We'll do our part. Thank you so much. So Shiza, back to you.
Thank you so much, Ma'am Naim Sab and Dr. Luqmani, for everything so far. I know every time I join one of these meetings, I leave feeling more inspired and just, reminding me why I'm going into healthcare in the first place. So I want to, before I conclude, I just want to express my deepest gratitude to everybody here and all the participants and all the speakers for just being a part of this incredible journey. Your dedication and passion for making the world a better place is truly inspiring. And on behalf of our healthcare volunteer group and our partner organizations, I wish everybody a wonderful evening. Thank you so much for joining. And let's all work together to create a better and healthier future for all. So thank you, everybody, and good night.
Thank you so much. Bye-bye.